that's actually one of the lasers that we use in our office. And for trauma, especially brain trauma and acute bleed trauma, it's really phenomenal. There's a company that has a lot of FDA approval for their use in lasers. It's called Zirconia. And their principal FDA approval is in the treatment of burns. And they actually have, I haven't been on their website recently, they used to have, they may still have, studies where a person who's a burn victim, they'll show the skin, you'll see it's red and oozing or even dark and oozing, and they'll treat it with the laser, and then they'll take a photograph of it later, and that oozing red flesh and raw flesh will actually, you can see it healing just in the sequence of photographs. It's very phenomenal. Some of you saw a little guy that had burned his eye with a marshmallow. Okay, his cousins were, everybody was playing around the campfire making s'mores, and one little cousin pulled out the marshmallow and turned around and stuck it right into the little guy's eye. Fortunately, his eye closed before it burned the eyeball itself, but all around the eye was burned and very, very swollen and closed. We used the laser and we used the chlorophyll complex, and Laura, you saw it?
He looks perfect.
Yeah, I mean, it's miraculous, really, how well it healed. And it was within 5 days. You could see it daily healing this second-degree burn that was blistered and raw, and his little eye was closed and all gooped over. But within 5 days, actually within 2 days, his eyes was open. His eye was open, and within 5 days, the skin had actually healed over. You could just see where the skin had been burned to the degree that the melanocytes or the pigmented cells were gone. But absolutely phenomenal healing.
Were they using the laser lights long before us over in Asia than they have been here? Because the man I trained underneath was using laser light 19 years ago.
Yeah. Yeah, so here's the funny thing. With my friends that are all dentists, originally laser was poo-pooed and said in dentistry you can't do that. So these guys that were real renegades and outlaws in dentistry were saying, no, we can get some phenomenal healing properties using lasers. We're using lasers. Well, they continue to use lasers and advanced lasers to the point now where they can actually do surgeries, dental surgical procedures without anesthesia. And what we've found is the healing time is reduced immensely, and the result post is so much better. And so now they've actually developed these periodontal procedures, which are called LANAT procedures, laser-assisted new attachment procedures, for people who've had